Welcome to our video about mental symptoms of untreated diabetes. Mental symptoms of untreated diabetes. If you suffer from untreated diabetes, you may experience the following mental symptoms. These may include frequent urination, fatigue, and depression. If you are suffering from any of these, you should visit your doctor immediately. Those symptoms are often caused by the stress of living with diabetes. While stress is part of everyday life, it can be a source of depression as well. In addition, stress can cause physical symptoms as well. Depression. Managing type 1 and type 2 diabetes can be difficult, and a patient's depression may be an additional challenge. Depression can be a result of chronic vigilance while navigating the complex world of healthcare and medications. Moreover, if untreated, depression can worsen the patient's physical health and lead to poor lifestyle choices. To better manage diabetes and prevent its symptoms, diabetes specialists should consider the comorbidity of depression. Although depression is associated with a greater risk of developing type 2 diabetes, the bidirectional relationship between diabetes and depression is poorly understood. It may also be a symptom of diabetes itself. Nevertheless, this bidirectional association is worth further study. Further studies are needed to determine whether diabetes causes depression, or if depression causes diabetes. The findings suggest that diabetes is a risk factor for depression, whereas depressive symptoms are associated with an increased risk of diabetes. Anxiety. Low blood sugar, or hypoglycemia, can trigger anxiety in people with diabetes. Low blood sugar can result in emotional reactions and constant testing. Some people purposely run high blood sugars to reduce the risk of hypoglycemia. Anxiety is an uncomfortable symptom of untreated diabetes and should be evaluated by a healthcare professional. Fortunately, treatment options for diabetes anxiety are available. When anxiety is associated with untreated diabetes, it can affect a person's ability to function in the world. They may even refuse to go somewhere unless their blood sugar level is higher than 250 mg/dl. In some cases, anxiety may be a symptom of a more serious health problem, such as depression or bipolar disorder. Fortunately, treatment options for diabetes anxiety include behavioral and medical counseling. Fatigue. If you're experiencing constant and severe fatigue, it's important to speak to your healthcare provider about ways to manage your condition. While fatigue is a common symptom of diabetes, it doesn't need to be permanent. Lifestyle changes, treatment modifications, and patience can all help. Read on for some ideas. Listed below are a few ways to deal with your diabetes and fatigue. Keeping your glucose levels at a healthy level is essential for a long, productive life. Oftentimes, fatigue is the first symptom of diabetes. People with diabetes often feel tired during the day, despite being able to perform their normal activities. However, fatigue can affect a person's daily roles and interfere with their work performance. Diabetes can also result in a person experiencing depression or other mental symptoms. When this happens, it can affect their overall health, which may lead to further complications. Frequent urination. Frequent urination is a sign of underlying diabetes. While you may only need to urinate once or twice a day if you drink a lot of water, you should be aware of the possibility that you may have a more serious condition. Diabetes causes the kidneys to work overtime to eliminate excess glucose from the blood. The result is frequent urination, often at night. If you're constantly thirsty, your body is not getting enough water from your diet. The hormone vasopressin, also called the antidiuretic hormone, helps regulate fluid levels in the body. When you have high blood sugar, vasopressin signals the kidneys to conserve fluids by returning them to the bloodstream. When the body lacks vasopressin, it produces more urine and makes the body retain less water. In addition, the kidneys are less effective at eliminating waste and water, and urine is not as concentrated. Polyphagia. The first signs of polyphagia are usually excessive hunger and thirst. A blood test can rule out other potential medical conditions. For diseases, medications are given to treat the condition. Hormone medications may be used for hyperthyroidism or genetic disorders. If symptoms continue, surgery may be necessary. Diabetics must monitor their blood sugar levels and adjust their diet. They also take regular insulin to control their blood sugar. Another sign of diabetes is extreme hunger and thirst. People with diabetes have a higher risk of developing polyphagia. These symptoms are often accompanied by other diabetic complications and can have a negative impact on daily life. If you are experiencing a high and low blood glucose level, consult your physician. Treatment for diabetes can help decrease polyphagia symptoms. The goal is to control blood glucose levels to prevent hypoglycemia, the underlying cause of polyphagia. Hyperphagia. While there is no definitive evidence that hyperphagia is caused by uncontrolled diabetes, it is likely to be a contributing factor. Fortunately, a variety of standardized forms and procedures are available for clinicians to use, including those trained at an annual diabetes research meeting. Furthermore, these forms could be used to give patients and their families standardized presentations of hyperphagia. In addition, standardized forms and procedures could be developed for treating hyperphagia and identifying the factors contributing to the condition. When the cravings are severe and persistent, individuals may be at risk of hypoglycemia, a medical emergency. In such an instance, they should keep glucose pills or juice in a convenient location to raise blood glucose as quickly as possible. Sometimes, it's difficult to differentiate hyperphagia from simple food cravings. Regardless, eating may provide temporary relief, but the cycle will continue until the patient's blood glucose levels become stable again. Polyuria. If you've been experiencing excessive urination, polyuria may be a sign of diabetes. This condition is characterized by the production of large amounts of urine at regular intervals. Typically, a person makes between 1 and 2 liters of urine a day. However, some people have a tendency to urinate more than 3 liters a day. In these cases, the patient should see a healthcare provider get a proper diagnosis. Patients with polyuria may require a change in their medicine or treatments. They may need to lower their dose or stop drinking alcohol or caffeine. It is also important to assess the patient's level of thirst. A change in diet may also be necessary. Eventually, treatment of the condition will include a change in lifestyle, medications, and diabetes treatments. Patients may need 24-hour urine collection for further monitoring. Polyphagia can lead to kidney dysfunction. Although binge eating and excessive thirst can be signs of diabetes, polyphagia is a separate condition. Polyphagia is excessive physical hunger, without accompanying feelings of mental or emotional craving for food. In some cases, the condition can also lead to kidney dysfunction, particularly in individuals with untreated diabetes. Although the condition may be difficult to diagnose, treatment can be individualized to meet each individual's unique needs. Symptoms of untreated diabetes can include a persistent and insatiable appetite, known as polyphagia. People with diabetes often experience both low and high hunger levels. Often, this craving is triggered by a strenuous activity, such as strenuous exercise. But it can also result from depression or stress. Uncontrolled diabetes makes the blood glucose in the blood not reach the cells, a condition known as insulin resistance. Getting active. Aside from the obvious physical effects of stress, the mental effects of untreated diabetes may also be a factor. It can be difficult to understand the exact connection between diabetes and stress, but both are directly related. The best approach to deal with stress is to get the help you need to deal with it in a healthier way. Diabetic support can help you cope with diabetes-related stress and change the way you think and act when you are stressed. It is important to seek treatment for mental symptoms of untreated diabetes if your physical health is deteriorating. There are some simple steps you can take to manage your diabetes. One of these is to get involved in a support group. Diabetes support groups are an excellent place to share your concerns and learn from other people with the same condition. Getting active for mental symptoms of untreated diabetes. Talking to a mental health professional. If you are experiencing depression or anxiety related to your diabetes, talking to a mental health professional may be a good idea. Even if you're not a patient, it's important to share your concerns with a health professional. Talking to a health professional can help you make sense of the condition and identify possible solutions. Depression is a very real side effect of untreated diabetes and needs to be treated as soon as possible. Anxiety disorders can be caused by the fear of fluctuating blood sugar levels. They can lead to a rapid change in mood and make it difficult to think clearly. These symptoms can interfere with your daily life and make managing your diabetes more difficult. Talking to a mental health professional about your feelings can help you take action to treat the condition. Discussing your fears and anxieties with a professional can help you overcome feelings of guilt or judgment. Thank you for watching. Please like, comment, and subscribe if this was helpful.